Hi guys, myself Ajinsha. Today the topic of my presentation is something about from the femur that is known as angle of inclination. First, we can see the definition for angle of inclination. Angle of inclination is an angle formed between an axis to the head and neck and the axis to the shaft of the femur or the longitudinal axis to the femur. It occurs in frontal plane. This picture shows the angle of inclination. Now we can see some of the features of angle of inclination. The normal value of angle of inclination is 125 degree. It has a variation between 110 to 144 degree. Angle of inclination varies between individuals and also varies within the individuals. Angle of inclination is lesser in females because of wider pelvis. It is decreased by age. In birth, it is 150 degree and it is decreases to 125 degree by maturity. Increase in angle is known as causa valga. Decrease in angle is known as causa vara. This picture shows the angle of inclination is decreased by age. Now we can focus on two conditions. One is causa valga and another one is causa vara. First, causa valga. What is causa valga? Causa valga is a condition which occurs when the angle formed between the neck of the femur and the shaft is increased to greater than 125 degree. Simply, we can say that the angle is more than 125 degree. This picture shows the condition causa valga. Here, the large portion of the head of the femur remains outside. In body, any single changes, that is any structural or biomechanical change can result in lot of different problems in the body. So, we can see what happens in causa valga. Causa valga leads to decreases in stability. That is, articular surface constant area decreases because the large portion of head of the femur remains outside and also held tilt upwards. Next, the weakness of the neck of the femur due to trabecular system. In neck, there are lot of trabeculars. The work of trabeculars is that it acts as a network of supporting beams to provide strength and support to bones. Here, due to the increase in angle of inclination, this trabecular formation got decreased. This leads to weakness of neck of the femur. Next, the momentum of abductors decreases. Normally, if the momentum between head, neck and the greater trochanter is 5 cm, but here in this condition, the distance between them got decreased. This leads to the weakness of abductors muscle. If the abductors muscle got weak, there is a problem in balancing and stability. Then, increase in joint reaction force. Here, the abductors are weak and the articular surface is also weak, so that the normal force against the joint reaction force increases. Next condition is causa vara. Causa vara is a condition which occurs when the angle formed between the neck of the femur and the shaft is decreased to less than 120 degree. Simply we can say the angle is reduced to 120 degree. This picture shows the condition causa vara. Here the head of the femur is fully enclosed by the acetabulum of hip bone. Causa vara leads to increase in stability of the joint. Then the trabecular system also increases. The momentum of abductors increases. Then the joint reaction force got decreases. Here the bending moment is more, so that it may lead to fracture of neck. That condition is known as slit capital femoral epiphysis. Classification of causa vara. We can classify the causa vara into three: congenital causa vara, developmental causa vara and acquired causa vara. First, congenital causa vara. Congenital causa vara are those are present or exist at the time of birth. Developmental causa vara. Developmental causa vara represents causa vara are not present at birth but rather developing in early childhood. Acquired causa vara. Acquired causa vara occurs due to fibrous dysplasia, rickets or traumatic proximal femoral epiphyseal flat closure. Thank you all for listening to my presentation.